Remodulin treprostinil injection. Indication: Remodulin is a prostacyclin vasodilator indicated for the treatment of pulmonary arterial hypertension (PAH) WHO Group 1 to diminish symptoms associated with exercise. Studies establishing effectiveness included patients with NYHA functional class 2 through 4 symptoms and etiologies of idiopathic or heritable PAH 58%, PAH associated with congenital systemic to pulmonary shunts 23%, or PAH associated with connective tissue diseases 19%. In patients with PAH requiring transition from epoprostenol, Remodulin is indicated to diminish the rate of clinical deterioration. Consider the risks and benefits of each drug prior to transition. Important safety information for Remodulin. Warnings and precautions. Chronic intravenous IV infusions of Remodulin delivered using an external infusion pump with an indwelling central venous catheter are associated with the risk of bloodstream infections, BSIs, and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion is the preferred mode of administration. Avoid abrupt withdrawal or sudden large reductions in dosage of Remodulin, which may result in worsening of PAH symptoms. Titrate slowly in patients with hepatic or renal insufficiency, because such patients will likely be exposed to greater systemic concentrations relative to patients with normal hepatic or renal function. Remodulin is a pulmonary and systemic vasodilator. In patients with low systemic arterial pressure, treatment with Remodulin may produce symptomatic hypotension. Remodulin inhibits platelet aggregation and increases the risk of bleeding. Adverse reactions. In clinical studies of SC Remodulin infusion, the most common adverse events reported were infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. The IV infusion of Remodulin with an external infusion pump has been associated with a risk of bloodstream infections, arm swelling, paresthesia, hematoma, and pain. Other common adverse events, greater than or equal to 3% more than placebo, seen with either SC or IV Remodulin, were headache, 27% versus 23%, diarrhea, 25% versus 16%, nausea, 22% versus 18%, rash, 14% versus 11%, jaw pain, 13% versus 5%, vasodilatation, 11% versus 5%, edema, 9% versus 3%, and hypotension, 4% versus 2%. Drug interactions. Remodulin dosage adjustment may be necessary if inhibitors or inducers of CYP2C8 are added or withdrawn. Specific populations. In patients with mild or moderate hepatic insufficiency, decrease the initial dose of Remodulin to 0.625 nanograms per kilograms per minute of ideal body weight and monitor closely. Remodulin has not been studied in patients with severe hepatic insufficiency. Safety and effectiveness of Remodulin in pediatric patients have not been established. It is unknown if geriatric patients respond differently than younger patients. Caution should be used when selecting a dose for geriatric patients. There are no adequate and well-controlled studies with Remodulin in pregnant women. It is not known whether treprostinil is excreted in human milk or if it affects the breastfed infant or milk production. Please see accompanying full prescribing information for Remodulin. For additional information, visit www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.